Okay, as always, we're going to begin with a couple of housekeeping items to make sure that you can hear and see us. And so I ask everybody to wave. So I think that you're all dialed in to wave. So I certainly appreciate that. We'll have everybody on mute during the program, but we will be watching. If you have a question while we're making the presentation, then just wave your hand. We have several people here who are our technology experts. If you have a question as we're going through, then we'll ask you to raise your hand. We'll try to get that question answered. Okay, so I can't advance my PowerPoint. There we go. Okay, sorry about that. Today is the heartbeat of cardiovascular care. Heartbeat of cardiovascular care. Today is a very special day indeed as we talk about the heartbeat of cardiovascular care, because we're being joined by two extraordinary people who we have the great honor to know and to work alongside. Bert Kellum will be joining us. You know, many of you know the name Bert Kellum. He has been on all of the Sun Health boards over the year, and he's currently chairing the Sun Health Foundation's Generosity for Generations campaign committee. Bert and Louisa have been involved with Sun Health since 1995. He has chaired boards, he's served on committees. He was the chairman of the Del Webb Hospital before the Banner transaction. And their contributions of time, talent, treasure, and testimony have made a true difference in our community. Many thanks to both Bert and Louisa. Thank you. Dr. Rajiv Kathuria is our special guest today, and he is a true hero with heart. Dr. Kathuria is a surgeon specializing in cardiovascular and thoracic surgery who has been practicing for 28 years at Boswell. He's on staff at several hospitals, but prefers Boswell, for which we're grateful. And he is a trusted and admired for the countless lives he has impacted in the Sun Cities and throughout the Valley, medical professionals he has mentored, and the physicians he has trained worldwide. Through one of his relationships with the supplier of heart valves, he provides a lot of education and trains young surgeons across the world. What's truly heartwarming is his deep connection with and his commitment to serving the residents in the West Valley. He refers to the Sun City West, Grand, that area, as "these are my people." And many of his patients and his family love him, and his families generally love him, and they are grateful for his skilled hands and his caring heart. Because of the life-saving surgeries Dr. Kathuria performs, and often at a moment's notice, today he's going to join us with a pre-recorded message. You know, last week, 2 weeks ago, we had a presentation on the Women's and Infant Services, and one of the presenters, OBGYN, couldn't join us because she was delivering a baby. So we learned that when we have these physicians scheduled to present, we always need to have Plan B, and in this case, Plan B worked out very well. So what Dr. Kathuria will be sharing about the progression of the cardiac care really ties into our Sun Health Foundation story about healthcare for the West Valley. So do we have anybody in the audience that this is the first time that you've dialed in? Oh, good. So many of you know the story. Oh, there's Diane, yes. Many of you know the story of Sun Health. You know, it's 50 years ago, there was a group of volunteers who passed the hat to raise enough money to build Boswell Hospital in 1970 and Del Webb in 1988. And then from then on, it just became the healthcare system of the West Valley. So because of these fine medical institutions right here close to home, that actually is one of the things that attracts and retains exceptionally skilled and dedicated surgeons such as Dr. Kathuria. So those early visionaries, we want to thank them because they have inspired future generations to come. As a matter of fact, in November, we will be celebrating Boswell at 50. So we're very, very excited about all of that. So if we're ready to go, I think we should proceed, and we'll start with the new developments in cardiovascular and thoracic care. Dr. Kathuria has a lot of great information to share with us today, so without further ado, let's begin. Dr. Kathuria will be updating us on new developments in minimally invasive cardiovascular thoracic care and sharing how this surgery has evolved through the years. Dr. Kathuria?
I've been doing this for close to 30 years here in Sun City. And we've taken care of thousands of patients over the time who've come into the hospital with cardiovascular disease. And so much has changed in my career that I thought today would be a good opportunity to discuss the types of things we're doing today that we were not doing those many years ago when we started this process, with my career at least, and what we sort of have to look forward to in the future. The biggest driver of heart disease in this country is coronary artery disease. That means blocked arteries that do not provide enough blood flow to the heart. So cardiovascular surgery revolves or has revolved around the treatment of coronary artery disease for a very long time. What has changed dramatically over the years is the advent of the minimally invasive approaches to treatment of coronary artery disease. A lot of people in the audience, I'm sure, know people or have had interactions with their cardiologists where they've had angiograms to look for blockages in the arteries of the heart. Beyond that, if there's blockages that are found, they've been given the options of potentially having a stent put in to open up those arteries. And in some cases, if stents have not worked or have failed, then they've been referred to somebody like me, who's a cardiac surgeon who performs coronary bypass surgery. A lot of people, of course, are afraid of surgery. The idea of having open heart surgery is frightening. The reality is that we still do a lot of coronary bypass surgery in this country. And as a matter of fact, despite the advent of these minimally invasive techniques, coronary artery bypass surgery is actually back on the rise nationwide. And that has to do with our growing population. So as we grow older, we're going to see more heart disease in this country, and we're seeing that. There's objective evidence of increasing numbers of patients with not only coronary artery disease, but also valvular heart disease. And that refers to valves that are inside the heart. There's 4 main valves in the heart, and we operate on or intervene upon probably 2 of them majority of the time, and they're the aortic and the mitral valves. And we can talk a little bit about that too today in terms of what has come or how far we've come in terms of treatment of valvular heart disease as well. So let's get back to the coronary artery disease first. What has happened is from the time I started this business, we did not even have coronary artery stents. We had what we called angioplasty. The idea was to go in with a balloon and thread it up through the groin and into the artery of the heart and open up the blockage with a very stiff plastic balloon. And that worked for a while, but it wasn't very good, and it didn't last very long. So metal stents, which are like scaffolding, were developed. And they've gone through several iterations. And now it's very commonplace for us to treat people who have coronary artery disease with stents, especially if only 1 or 2 arteries are involved. And if the arteries are very heavily calcified, if the stents have failed, then of course people will be sent to a cardiac surgeon for conventional surgery. But the majority of patients, the vast majority of patients with coronary artery disease today are treated with non-surgical aspects of care, such as coronary angioplasty and stenting primarily. As far as the valvular heart disease is concerned, a lot of you may have heard of a term called TAVR. It's called it's an acronym for transcatheter aortic valve replacement, TAVR. This has come of age over the last decade, and we are increasingly now treating aortic valve stenosis, which means a narrowed aortic valve, which is not opening properly to let the blood out of the heart with each heartbeat with this technique. And again, kind of like what we discussed a few minutes ago about coronary artery disease, this is a stent procedure. So in conventional cardiac surgery, which we've done for the last 50 years for this condition, aortic valve replacement has meant surgery, which is opening the chest, putting a person on the heart-lung machine, stopping the heart. We cut into the aorta, we cut out the aortic valve, which is very calcified and is immobile, and replace it with a valve that works properly. And there's different kinds of valves we use. In most patients in this community who are older, over 60, we would use what's called a biological valve. And that means a valve taken from an animal's tissue or made of an animal's tissue. that does not require lifelong anticoagulation or blood thinners. In younger patients, less than 50 years of age, we still use what's called mechanical valves. Those are man-made material valves which require anticoagulation or warfarin for the rest of your life. What has happened with transcatheter techniques is we are now able to treat a lot of patients, especially if those who are older or more frail, where we think that their risks for operation are increased with these transcatheter techniques. So rather than doing conventional surgery, where I as a surgeon go in and actually remove the diseased valve and replace it, we're now putting a stent within the valve. So we're not taking it out, actually. And that procedure is done by, again, going through the groin, and it's a catheter-based procedure. The stent comes in a collapsed form, so it can go through the artery, in the groin, up through the aorta, and up into the heart, and we position it right within the aortic valve. So the diseased valve then gets opened up with a stiff plastic balloon, and behind that is a stent that opens up the valve and keeps it open. Now the stent keeps the old valve open and out of the way, but inside is a new valve, again, made from an animal's tissue. So without having open surgery, we've now treated what we call severe aortic valve stenosis. Works very well. It's a minimally invasive procedure. We've done a lot of them at Boswell over the last 5 years, close to 450 of them at this point, and we are continuing to increase the number of, we're continuing to see more patients who need this condition as the population ages. And so transcatheter interventions for valvular heart disease, I think, have completely changed the landscape of valvular heart disease, how we manage it in this country, and these are things that are going to continue to improve in terms of what we do, how we do them, how minimally invasive we can make a process. At this point, patients come in, have the transcatheter valve done, go home the next day. We're probably going to start doing them as outpatients. I would think perhaps within the next couple of years, patients are going to come in, have this procedure done, go home the same day. I mean, that's a far cry from coming in to have open heart surgery and being in the hospital for 5 or 6 or 7 days, as has been the case for a very long period of time. For patients who are either not good candidates for transcatheter intervention or where we don't think transcatheter intervention is appropriate because they are fairly healthy and we want them to have the best benefit of an intervention, we still offer, obviously, conventional heart surgery. And while most conventional heart surgery is done by what's called sternotomy, where we go through the breastbone to get to the heart, in our practice, and my personal practice over the last decade or more now, we do what's called minimally incisional valve surgery, where we make a 2-inch incision right over here between the ribs and the front of the chest, and we're able to replace the aortic valve through that small incision. And we've done hundreds and hundreds of these operations over the years, right here at Boswell Hospital. So a lot of folks here in Sun City and Sun City West, and other people who are winter visitors who have come and gone, have benefited from these minimally incisional procedures that we've gotten to be very good at. And as a matter of fact, we're recognized for it not only locally and regionally, but nationally for it. In our program, we have had an educational program where we've trained surgeons on minimally incisional valve surgery over the last 10 years from all over the world. We've had surgeons from all over the country, obviously, but we've had surgeons from Japan, from Europe, from Canada, from South America, Puerto Rico, you name it, Australia. So we've had surgical teams fly into Phoenix and come to Banner Boswell Medical Center to learn these minimally incisional valve surgical techniques. So we're very proud of that, obviously. One of the other major valves of the heart that we work on a lot is called the mitral valve. And the mitral valve sits between the lungs and the heart. That allows the blood from the lungs that's been oxygenated to come into the heart. And when the heart beats, then the oxygenated blood goes back into the body. So it's a very, very important valve. And a lot of those mitral valves tend to leak. And there's lots of different reasons. But the commonest reason in this country is what we call myxomatous degeneration. The valve tissue just degenerates and the valves don't have competency anymore. And we do a lot of mitral valve repair surgery for that type of a condition. And we also replace mitral valves, just like we replace aortic valves. And the mitral valve can also get stiff and not open, just like the aortic valve that we discussed earlier. And most of those valves that are stiff are due to what we call rheumatic heart disease, which we're seeing less and less of in this country as the patients now are getting older. We used to see a lot of rheumatic fever in the earlier part of, or I should say the first half of the 20th century. And we didn't have antibiotics, we had infections that were not treated properly. But in the second half of the 20th century, after the appropriate antibiotics have been developed, and when we realized what the cause of rheumatic fever was, we saw less and less. We still see a few cases a year, but most of the rheumatic heart disease now in the world is seen in the developing world rather than the United States. But we still have some patients who have rheumatic fever or have had rheumatic fever type illnesses in childhood who will develop what's called mitral valve stenosis. Those valves have to be replaced, and we still do surgery for that. But those valves that leak, and there's lots of different reasons for mitral valves that leak. Sometimes it's because the heart is weak. Sometimes people have had a heart attack. There's not enough blood flow going to the heart muscle. It has affected the function of the valve. But most commonly, as I mentioned earlier, myxomatous degeneration, the actual tissue degenerates as we get older and the valves leak. So those valves need to be either repaired, as we like to do mostly, or sometimes replaced. And as far as minimally incisional techniques related to the mitral valve, there's several new procedures actually coming down the pike. The one that is now FDA approved is called a mitra clip. And that is a procedure where we are trying to reduce the amount of leak of the mitral valve backwards towards the lung. And again, catheter-based procedure, we go through the groin and snake the catheter up into the heart, and it's a clip. So the mitral valve has two leaflets, the front and the back, what we call the anterior and posterior leaflets, and both of them open and close like this. And when they sort of buckle backwards, what we call mitral valve prolapse, it causes a leak of blood between the two leaflets. And the clip goes in from inside the heart and grabs one leaflet and the other leaflet and just literally clips it in the middle, so the two leaflets then come together and the blood doesn't leak backwards. Now, currently, this technique and this procedure is limited to those people that we think are prohibitively high risk for conventional surgery. But it works very well. And again, for patients who are older, who are frail, who we may not want to operate on because the risks are higher, mitra clip is a great opportunity for them to have this condition treated.
Wow, wasn't that something? How far medicine has come, to think about open heart surgery and being in the hospital for a week a decade ago. And now he's talking about doing the TAVR process as outpatient. That is just amazing. I'm glad that we taped this because, again, he's in clinic today. And of course, those heart patients need his attention. I did suggest that if you have questions to wave your hand, but we don't have anybody here to answer them. I guess I could make up the answer, I don't know. But seriously, if you have a question, we are happy to take that question and we will get it to Dr. Kathuria and he will answer that question when he's not in surgery. How about that? So please let us know if you have any questions and we will be happy to take that. Okay. All right, I can't get my... Okay, so next. We'll talk about the emergency department and patient care transformation. Is that correct? Okay. So Dr. Kathuria also shares his perspective about the emergency department transformation at Banner-Boswell and how it will further enhance cardiac care. Dr. Kathuria?
So we're very excited about the new expansion at Banner-Boswell Medical Center. As you folks know, we've been working on an expansion plan because our emergency department, which sees a lot of patients every year, had gotten too small and outdated for our needs. And so this new emergency department is going to give us the opportunity to provide first-rate, state-of-the-art care for patients here in the West Valley. In conjunction with the emergency department, we have a new heart center that is being built. And that will allow us to provide world-class care to patients here in this community, to include any and every aspect of cardiovascular care, not just the surgical piece that we've referred to earlier, but all cardiology services, including electrophysiology services, congestive heart failure management, and obviously interventions for emergencies such as heart attacks. because of the physical layout of the new expanded building, what we'll be able to do is to get those patients who need emergency care to our new cardiac cath labs very, very quickly because of the proximity of the new cardiac cath labs. And eventually, when we have the building completed, we will have a new, what we call a hybrid operating room, where we can do things that can't just be done in a conventional operating room or in a conventional cardiac cath lab. So it has the ability for us to do transcatheter interventions as well as conventional surgical interventions all in the same room because of the technology that's built into the room.
Okay, wow, that's amazing. I would be remiss if I didn't let all of you know that our CEO, Joe LaRue, joined us a little bit ago. So let's all wave to Joe. Hi, Joe, thanks for joining us. Also, Sharon Grandpa, our CFO, has joined us as well. So thank you for being part of this today. Appreciate your dialing in and being so interested in hearing what Dr. Kathuria has to say. So what Dr. Kathuria has just relayed further underscores the importance of community support for this transformation. It's amazing. As some of you have been on our coffees where we've shown the progress of that construction project over on the Boswell campus, and you heard Dr. Kathuria refer to this heart center that will be connected to that as a world-class program of distinction that he is leading. It will be just amazing, and very soon we will be able to give tours of the new emergency department. As a matter of fact, they're going to see their first patient in less than 3 weeks. October 6th will be the first patient coming in. That's amazing how that has progressed. Now I'll talk a little bit about community support. You've all been aware that we have themed this campaign Generosity for Generations, and having conversations with Dr. Kathuria about his generational care is amazing as well. So for generations, the partnership between the community and support for superior healthcare has been very unique and very special indeed. And Dr. Kathuria feels that so deeply that he wanted to make sure that he had a chance to speak about that today as well. Dr. Kathuria?
So my association with Sun Health and Sun Health Foundation goes a long way back to when I first came to town. And over the years, I've had the opportunity to come and speak to various groups in the community. I've given talks at churches and attended dinners and lunches where we've spoken to community folks about the importance of community support for our hospital. And what I've been fortunately part of is, for example, a fundraising campaign many years ago that helped us build our first hybrid operating room. So the fact that we're able to do transcatheter interventions in that room today, and it's running 5 days a week with not just me or a cardiologist working in there, but radiologists, vascular surgeons, at this point, interventional pulmonologists, all of them are using that very high-tech room, which was made possible by contributions from the community. So we're very, very grateful for the philanthropic support of Sun City West community and other folks in the West Valley who've been supporting Banner Boswell Medical Center and Banner Del Webb Medical Center for all these years that I've been around. And the new building is another example of what can happen when the community comes together to support the hospital that provides care for them. And this new expansion is going to allow us to provide better care for the folks that we're serving here.
Thank you, Dr. Kathuria, for saying this so beautifully. You really touched my heart. What we just shared reflects the heart of superior healthcare that beats stronger with community support. And many thanks to all of you who participated as well. Generations of patients and quality of care. This support does span generations. We've had many generations moving into the community, and you'll hear a little bit more about that from Dr. Kathuria. And he also has provided care that spans generations as well, which he talks about in this next slide. Dr. Kathuria?
One of the most fulfilling parts of my career has been the fact that over the years, we've seen patients and their families come through these doors that have required care of different types, but specifically to what I do, I've been blessed with the opportunity of operating on patients and really families over time. I've operated on husbands and wives, daughters and sons, brothers and sisters and in-laws of patients over the years. I may have operated on somebody in 1998 and then operated on somebody from the same family in 2003. And what it tells us is not only are the patients in this environment, in this community where we practice, a cohesive group of folks, but they trust us to come back to our hospital, to come back for the type of care that we provide here. I've been extremely passionate about the care that we provide at Banner Boswell Medical Center, and I have been for close to 30 years now. But it's particularly exciting for me to see younger folks who are now coming to Banner Boswell for their cardiovascular care. Because of the changes in the demographics in the west part of town, I think we should really encourage this and work on getting a larger group of folks from around this area beyond Sun City and Sun City West to include Surprise and the other areas around this hospital, because they need to understand that we have a very, very large experience in terms of cardiovascular care, and generally lots of other specialties as well. But specific to what I do, we have one of the best hospitals in the country. We've been named as in the top 50 and the top 100 heart hospitals for years, more than any other hospital actually in the state of Arizona. U.S. News and World Report has recently named us twice in 2 years as the second best hospital after the Mayo Clinic. So we're very proud of the work that's being done in this hospital. And this expansion of the emergency department, the new patient towers, the new heart center is only going to make this institution better.
Oh, how amazing is all of this? You heard the pride in his voice and his affinity to Boswell and to the healthcare system here in the West Valley that's been built through philanthropy. Of course, he's just humble enough that he doesn't talk about it's his work that has made that such an outstanding facility. So we thank you, Dr. Kathuria. It's just amazing to hear your commitment. So to know that the many people who Dr. Kathuria has touched and the superior quality of care that we enjoy, it just keeps getting better and better. Thank you. So the other side of Dr. Kathuria, what he most enjoys about his work, and this is very touching and really touches my heart when we talk about this. Dr. Kathuria, tell us.
Medicine has changed, I have noticed people, physicians, nurses, other folks from a different generation are now practicing healthcare, and you think to yourself, given what the opportunities are outside of medicine, why does anybody provide healthcare? Why is anybody in medicine? And there's a common thread in each of us that does this, and that is that we truly care about taking care of patients. So in my entire career, I can tell you, and I've said this to my wife, if the day ever comes that I don't care what happens to a person that I've operated on, tell me so I can hang it up. Because to me, it is absolutely critically important to absolutely provide the best care you can for a given individual. Because these people who are under our care are trusting us with their lives. They're the most vulnerable that any person can be when you're in a hospital and you're sick. And if you, as a physician or a provider, cannot provide that level of compassionate care, then you're not in the right business. So I feel very strongly about that. And I actually make this a point to the folks I work with, to the nurses that I work with, to our PAs and nurse practitioners, that I want to see only the best, the most compassionate care that we can provide, but also at the highest level in terms of the quality that we can provide.
Well, what a deep commitment he has to his patients and the quality of care he and his team provides. And I can attest to his commitment as I've spoken with other physicians, anesthesiologists, other heart doctors, the leaders at the hospital. They absolutely affirm that that is his passion around his work. It's just, if we have to have a heart attack, we certainly could have it here and feel like we're in very good hands. Thank you, Dr. Kathuria. Okay, so his philosophy of caring for patients. Dr. Kathuria has so many great things to say, including his philosophy of care for patients. So we just have one more to share about that. Dr. Kathuria?
As medicine has changed, I have noticed people, physicians, nurses, other folks from a different generation are now practicing healthcare. And you think to yourself, really, when I was very young, as a child, I knew I wanted to become a physician. And one of the things that...
Okay, we've had a little bit of a technical difficulty, so we want to go back to a slide so that you can hear about his philosophy of caring for patients. All right, Doctor.
As medicine has changed, I have noticed people, physicians, nurses, other folks from a different generation are now practicing healthcare. And you think to yourself, given what the opportunities are outside of medicine, why does anybody provide healthcare, or why is anybody in medicine? And there's a common thread in each of us that does this, and that is that we truly care about taking care of patients. So in my entire career, I can tell you, and I've said this to my wife, if the day ever comes that I don't care what happens to a person that I've operated on, tell me so I can hang it up. Because to me, it is absolutely critically important to absolutely provide the best care you can for a given individual. Because these people who are under our care are trusting us with their lives. They are the most vulnerable that any person can be when you're in a hospital and you're sick. And if you, as a physician or a provider, cannot provide that level of compassionate care, then you're not in the right business. So I feel very strongly about that. And I actually make this a point to the folks I work with, to the nurses that I work with, to our PAs and nurse practitioners, that I want to see only the best, the most compassionate care that we can provide, but also at the highest level in terms of the quality that we can provide.
Well, we actually thought that bared repeating because it was such an important point to make. We wanted you to hear it again in case you missed it the first time. So I could listen to him talk a lot, and he doesn't usually repeat himself. He's really on target, but so this was on us, but I thought it was worth repeating. So next, we're going to talk a little bit about what inspired him to go into this line of work. And we hope that we've captured this on the video, because there's many layers of Dr. Kathuria. As you've seen, there's this brilliant surgeon, there's an amazing professional, there's a caring individual, but we've also seen another side of him. So when he talks about what inspired him to go into medicine, he gets real regular and he gets a little giggly about this. So I'd love for you to hear why he chose this career. So Dr. Kathuria.
Really, when I was very young, as a child, I knew I wanted to become a physician. And one of the things that crystallized that decision was when my grandmother had her cataract operation. And I was probably 8 years old. And I was fascinated by the idea that a surgeon, under local anesthetic, can cut open the eye and take out a cataract, which is a lens in the eye that has become opaque with age. In those days, we didn't replace lenses. We only could take the cataract out. And of course, that was many, many years ago. And now cataract surgery is done in about 15 minutes. And you go in and you remove the old lens and you put a new one in and you walk out and you can see. But the idea then of under local anesthetic, going in, removing the lens, and having my grandmother see better and more clearer with glasses was amazing to me. And I thought, this is fantastic, and this is the sort of thing that I want to do one day. When my brother became an ophthalmologist, I didn't. I became a cardiac surgeon. And when I was in medical school, in my junior year, third year of medical school, we had clinical rotations. So we were given the opportunity to go through different fields of medicine to get an idea about how internal medicine works, what happens in surgery, what happens with OBGYN, family practice, you name it, all the different major specialties. And during the surgical rotation, which is 8 weeks long, 2 weeks were dedicated to cardiac surgery. And I remember the first day I walked into the operating room as a medical student and scrubbed in on the first cardiac surgical operation, which was a open heart surgery for bypass surgery, and watching the heart beating within the chest. That was it for me. I was sold.
So when we had a conversation about this, he said, when I walked in and saw that heart beating in that open chest, they had me. They had me at the heart beating in the open chest. Very moving. That tells us his dedication to what he does and how grateful we all are that he is here with us. So in a few, closing with the session with Dr. Kathuria, we of course wanted to know if he had any heart health tips and what was important. And our team member, Linda, when she was quizzing him on this, she really got into some details. So we had to cut this one a little bit short because she was very curious about his exercise routine. So we pulled that one out. But I'd like for you to hear what Dr. Kathuria has to say about heart healthy tips. Dr. Kathuria?
For many years now, including today, cardiovascular disease is the #1 killer of Americans. And there are multiple reasons for this. As everybody knows, we have an epidemic of obesity in the country. And that has not helped this process. There are risk factors that we can identify and have identified for many years that predispose somebody to developing coronary artery disease, which is to say smoking, high blood pressure, high cholesterol, or dyslipidemia. Sometimes it's not the actual number that's high, but it's the type of cholesterol in your system that is not the healthy one that's high. Diabetes mellitus. There are things that people can do to mitigate their risk for heart disease by basically having a healthier lifestyle. Regular exercise is of the utmost importance. And this has been shown in study after study that folks who have regular exercise regimen in their life from any age on are actually helped through their latest years. And it helps in so many ways, not only in terms of heart health, but also in terms of brain health. So exercise is very, very important. That lowers your blood pressure, it lowers your cholesterol, it lowers your blood glucose levels. It conditions your heart. It reduces your weight, which is less taxing than not only to your heart, but to your entire body, and keeps you mentally sharper. So if there's one take-home message, it is to include an exercise regimen in your daily routine.
Great information that we can all take to heart. You may have noticed all the ways we've been using the word heart in our sentences and our conversations today. We've had a lot of fun with this, and we hope that you have as well. So no matter how you use the word, it has the power to transform lives, and so does the power of philanthropy. So what a perfect transition to introduce Bert Kellum. You heard me kind of describe him a little bit before, and he's been very involved. So Bert's going to offer some unique and inspiring words and from his very unique perspective. So we invite Bert to come on and share his closing remarks with us. Bert?
Thank you, Gina, for inviting me to this wonderful coffee. This is really nice. We're going to do this more often. And thank you, Dr. Kathuria, not only for the life-changing information you shared, but this is also deeply personal to me. 7 years ago, my wife, Louisa, suffered a heart attack that required a quadruple bypass at Banner Boswell Medical Center. In short, he saved her life. We were so fortunate and grateful to have Dr. Kathuria perform the surgery. Louisa later said that it didn't even frighten her, although she actually slept through the whole thing. But to the rest of the family, we were petrified. There's an old axiom that goes, the walls of many hospitals have heard more prayers than the walls of many churches. I think that might actually be true. So it's only appropriate that I invite you to join me in honoring Dr. Catharia at the Heroes with Heart virtual gala. This gala, to take place via Zoom, will occur on Saturday evening, November 7 at 7 p.m., 7 at 7. Please mark your calendars, and for those of you who purchase Premier, Patron, or Partner tickets, you can look forward to receiving special surprises in your mail. At that time, you will hear the entire story that Louisa and I are proud to share, as well as other comments and testimonials during an inspiring and festive program. We'll have a band, an online auction, prize drawings, and a toast to superior healthcare. This special event commemorates the 50th anniversary of Banner Boswell Medical Center. The event benefits the hospital's emergency department and patient care transformation. This is a major initiative in Sun Health Foundation's Generosity for Generations campaign. I know that so many of you have already contributed in support of superior health care, including cardiac care. Louisa, I would like to personally thank you. Generations of donors have and continue to make a true difference in ensuring that all of us have the very best health care possible. Did you know that Banner Boswell Heart Center is considered a world-class program of distinction, and that more heart surgeries are performed here than at any other hospital in Arizona? And that for 5 straight years, they've received the top 100 hospital designation from the National Rating Services. There are, incidentally, 4,000 hospitals in the United States. No one else in Arizona has ever been able to do that. For superior heart care, I really don't know of a better place to be than right here. If you have ever received care from Dr. Catharia, along with the exceptional skill of fine surgeons such as Dr. Catharia, generations of generosity from the community for the community have contributed to the superior health care we are so fortunate to have today. Have you received care from Dr. Catharia? As a campaign chairman, I would be very remiss if I didn't ask if you'd like to make a tribute gift in his honor. This gift will also benefit the greater community by supporting superior health care. Or perhaps you might have a comment or a testimonial you'd like to share. We'd love to hear from you. Your contributions of testimony as well as treasure are true gifts and reflect the great power of philanthropy. As we know, the gala event will benefit Banner Boswell's emergency department, which, by the way, will include a beautiful donor recognition wall with an artistic tree with donor leaves as well as an electronic display. A tree was chosen because it has strong roots and provides shade and comfort to those sheltered under it. Wouldn't it be amazing if we could all participate in adding our name to the leaf on the wall? Together we can build stronger roots and even more shade for this and future generations. What an unforgettable way to celebrate 50 years of superior healthcare and honor those who've made a difference in our lives. For details on the donor recognition wall, please contact Gina directly or a director of philanthropy at the contact information on your screen. To RSV for the gala, to share your tributes and testimonials and comments, please contact Janine McGee. Her contact information is also being shared on your screen. We hope you join us at the gala and for future coffees. Virtual get-togethers are conducted regularly on Zoom to help keep you posted on different healthcare updates. Please look for more information. While we totally understand that many of you may have heard this message before, it bears repeating. Because your health and well-being are so important, please don't delay the medical care you might need because of the special times we're in. You can trust Banner Boswell and Banner Deli Webb Medical Centers to provide safe medical care. We wish all of you health and wellness and continued safety. Thank you very much for joining us.
Well, Bert, thank you so much for making those closing remarks. And as you heard, we're excited about the new emergency department and going to be opening up. We're excited about the virtual gala honoring Dr. Catharia. We'd love your testimonials if you had a situation where he's cared for you. Many are stepping up with tribute contributions to honor him, and he's so pleased about all of that. So we will continue to keep you informed. We're so pleased that all of you joined us today. We have some new folks on the call. We have some people who've been here through many of our virtual coffees, so thank you. So our next virtual coffee, and you'll be getting the invitation shortly, is going to be a little bit different. Our board chair, Jerry Solomon, is going to team up with the chef. This will be just before the gala. So on October the 20th at 5 o'clock in the afternoon, they will be offering you some suggestions around food preparation and wine pairings. And so that will be a lot of fun. And for those of you who want to join us and would like a little wine delivered, Joyce, are you delivering wine?
I can.
She said, yes, she can. So watch for that invitation. Be sure to let us know and share this with your friends. It'll be very interesting in preparation for the virtual gala. So again, many thanks to all of you for joining us. Stay well, stay healthy, and let's stay in touch. Bye-bye.